Well, thank you all for coming, and it's a great opportunity to talk about OHSU and its relationship with the Veterans Affairs Hospital in Portland. I'm an emergency physician by training and also the Associate Dean for Graduate Medical Education at Oregon Health and Science University. Before I dive into the topic of the day, I'd like to just introduce my institution to you. We were established in 1887. We just celebrated our 125th anniversary a couple of years ago. We have two main hospitals, University Hospital and Dornbecker Children's Hospital, that sees nearly 900,000 unique patient visits per year. We are the only academic medical center in the state of Oregon, a state that's well known for its leadership in healthcare policy and reform. And more importantly, for you folks today, we had a strong and long-standing relationship with our Portland VA Medical Center. The VA Medical Center in Portland is a 277-bed hospital that sees about 800,000 outpatient visits per year and sees veterans from a very large catchment area, which includes the entire state of Oregon and portions of Southwest Washington, all the way out to Boise, Idaho, and parts of Northern California. Just a little bit more about OHSU. I want to brag a little bit about it. For those of you that don't know us very well, I wanted to just point out that we are leaders in some of the key indicators around what the nation is going to need in terms of healthcare providers. That includes rural care, primary care, and nurse practitioner and physician assistant education, so-called advanced practice providers. And we're proud to rank very highly in the annals of internal medicine ranking for what educating physicians for what will most be needed by society in the future. So here's an aerial view of my home institution, and I wanted to point out, just give you an orientation. So here is Oregon Health and Science University, overlooking the Willamette River. Here's our Children's Hospital, and over on your right is the Portland Veterans Medical Center, which was built in 1989. And along with that construction was a sky bridge that actually links the Portland VA with Oregon Health and Science University. And I'll give you a little bit more detail on that in the future, in just a few minutes. But I wanted to just take a minute and give you a bird's eye view on the ground of what GME looks like with relation to the VA. GME, Graduate Medical Education, as mentioned before, educates an entire spectrum of physicians. This happens after medical school graduation, and newly minted physicians coming out of MD and DO programs enter into 3 to 7 years of primary certification training for a spectrum of specialties, from internal medicine to pediatrics all the way to otolaryngology and dermatology. Some go on to specialty care that occurs after their first residency, which is then called a fellowship, and this includes specialties such as cardiology, gastroenterology, and the like. Two really important ones I wanted to mention was geriatric medicine and addiction psychiatry, which I'll come back to in a minute, but those are fellowship programs. Our residents and fellows provide a tremendous amount of care both in the hospital as well as in outpatient clinics at both institutions and a number of institutions around the city. And that contribution becomes increasingly important as the trainees move into their senior and chief years. They're always learners and always supervised, but start off mostly as learners. We're straight out of medical school, but become very important service providers as they become more senior in their training. And I think we are pretty typical of the relationship between the academic medical center and the VA that you see around the country. It's an extremely valuable partner for us in all three missions, both education, clinical service, and research, as well as educating not only residents and fellows, but medical students, nursing students, and the like. So as I mentioned, we have over 800 residents and fellows in 79 programs at OHSU. And our statistics are a little bit different than what's been quoted. Nationally, somewhere between 2/3 and 3/4 of residents do some of their training at a VA hospital. For us, it's actually over 700 of our 820 residents. So closer to 85 to 90% of our residents spend some time training at the Portland VA in an entire spectrum of settings and specialties: inpatient, critical care, operating room, outpatient clinics, etc. It's important to realize too that not all training can happen at the VA. With rare exception, residents and fellows that are recruited and are in accredited programs will need to do some of their training outside of the VA. For instance, a surgery resident may do a great job of general surgery and vascular surgery, etc. at the VA, but then may have to come back to their academic home for burn unit experience or trauma surgery. The same is true with specialties that require pediatrics training. So when we talk about training and service at the VA, we're really talking about a combined, comprehensive training program that needs to be accredited and needs to fulfill all of the regulatory requirements as set forth by the GME, Accreditation Council for Graduate Medical Education, and other accrediting bodies. So the VA is absolutely essential in providing these training opportunities, but the VA can't do it alone. Now, as it's been mentioned, the VA has really been the only expanded funding stream over the last 15 years, and kudos to them, having recognized the need for their particular population of patients needing more care. And of our 800 residents and fellows, of which 90% or so actually rotate at the VA, our VA is our biggest partner. They actually fund about 175 full-time equivalents that includes salary and benefits. But as I mentioned, OHSU is the accredited sponsoring institution. So everything else that happens for a resident or fellow really occurs out of our office at OHSU. This includes recruitment, this includes faculty development, administrative oversight, the quality of training, the quality of the new term is the learning environment, to make sure that it's supportive, that it supports professionalism and transparency, physician wellness, remediation, and all other support systems come out of the academic medical center. So the VA is absolutely essential, but the VA relies on us to provide a very broad and deep infrastructure for training. And again, that accountability piece we have to the GME is essentially borne by us at OHSU. And again, that's fairly typical. Now, I wanted to just call out some of our efforts around our own state. Part of our mission is to reach out and collaborate and partner with other institutions across geographic boundaries and go to the communities and ask them, what is it you need in a community health model? So very much like the VA is a microcosm of the needs for other populations. When we talk about primary care, we also have to talk about access to specialty services once they have been entered into the system. For instance, if a patient needs has an issue with hip arthritis, getting primary care is a great first step, but definitive care is going to require an orthopedist, an anesthesiologist, a radiologist, a physical therapist, and a whole range of team-based care in order to make that care really definitive and comprehensive. So I really want to close with a close-up of the bridge between the Portland VA, which is on your left, and Oregon Health and Science University on your right. So it was built in 1989, along with construction of the new VA. It's a 1/4 mile long suspension bridge, and I'm told, and I believe this, that it's the longest pedestrian bridge in the world. How about that for a step? And we call it the Sky Bridge, and not surprisingly, it spans a ravine that used to require a patient getting from one institution to the other, getting into an ambulance or other transportation and driving around the hill, down the ravine, up the ravine, and to the other institution. So it's not only an amazing engineering and structural feat, but it's really an iconic structure at our institution. And it's quite symbolic of the strong link that we have between our health center and the VA. Every day, hundreds, if not thousands, of residents and fellows, physician faculty, students of all kinds, patients, researchers, and staff move back and forth across that bridge, not only carrying themselves, but also the expertise and the knowledge that is shared. And it's really part of a complex ecosystem of clinical care, education, and research that we enjoy between our two institutions. So there are ways to, I think, look at this access problem, and certainly we have to consider all of the things that have been mentioned, either looking at the cap or and raising that, or developing new sites for training that through CMS, or increased funding through the VA Health Center and that system. But while the problem has been called out at the VA, I truly believe that that is a harbinger of issues that will become apparent across all other populations, including those that are currently underserved, rural, urban underserved, the Indian Health Service, the disabled, the elderly, really thinking about what are the needs of those people in 20 to 50 years, and how can we build a system that incorporates the workforce pipeline that can address those needs, and doing it mindfully and doing it deliberately is really key. So we're looking forward to being part of the solution, and we're eager to work with our partners at the VA to try to create that. Thank you very much.